persistent pain in the back and or legs after surgery. A lot of it can be due to the surgery. The fusion itself can cause pain above and below those joints. Some scarring in the epidural space can cause problems, but it's a huge problem in our society today. Fusion surgery increased by 220% from 1990 to 2000. There's about 10 to 46% of patients who undergo spine surgery can have this problem. Failed back surgery syndrome can be a variety of different presentations. One of the ways to diagnose is really to figure out what type of surgery they've had. Have they had a microdiscectomy? Have they had a fusion? And also to rule out if they have any sort of what I call red flags. Do they have any persistent weakness, any persistent loss of bowel or bladder function, any headaches? But perhaps they don't have those problems, they just have pain that persists. We want to try and figure out what type of pain is it. Is it burning? Is it going down the leg? Is it sharp shooting? So we want to determine if it's more of a neuropathic component versus a nociceptive component. When we think about failed back surgery syndrome, we can break it down into certain components. So we can certainly think about with the surgery itself, they've had to cut through a fair amount of muscle tissues and muscle layers, so there might be a myofascial component to their overall pain. There's likely, if they had a fusion, potentially we can also, again, we can potentially assume that there might be a problem with accelerated degeneration above and below the fusion. And then certainly if they have a nerve component or if they complain about burning or burning pain, that we might be able to get an MRI and look for any sort of scar tissue in the epidural space that may explain their problems. So the treatment is going to be, again, based on what the predominant pain component is. So if they have more of a myofascial component to their pain, so if it's more muscle pain, we're going to focus on trigger point injections, maybe some physical therapy. If they have more of a neuropathic pain, we're going to try epidurals, maybe some steroid-based therapies for them. And if they have more of a pain arthritic in nature, dull aching, and it's confined really to their back, we might think about trying some anti-inflammatory type medications like naproxen, Aleve, those types of medications, and potentially we can try some medial branch blocks or facet procedures to help their pain. Opioids are second, third line after everything's failed. If nothing else works, then we can maybe consider opioids at that time. But really we want to be cautious because these patients who are people who've had failed back surgery syndrome and are on opioids don't do better. A patient who's coming in after surgery, they can have pain for a variety of different reasons, and it's in the patient's best interest, in our best interest, to try to figure out what the predominant cause of their pain is so that we can really adequately treat them.